Hello, my name is Jessie West, and I am a MSN student at Herzing University with a concentration in nursing education. This is my presentation on my Nurse Educator Strategic Plan. I'll start off with a small introduction about myself. So I graduated from Alverno College in Milwaukee, Wisconsin with my BSN in December of 2019. Throughout college, I also served in the Army National Guard as a diesel mechanic for 8 years. Although I did not apply my nursing knowledge to my military career, I was able to develop my leadership skills throughout my time in the Army, which have now transferred over to my nursing career. Most of my career has been in pediatric hematology, oncology, and bone marrow transplant. However, I have worked in other specialties as well. Part of my career thus far has been working as an infusion nurse in rheumatology, and I've also worked as a hospice nurse case manager and briefly as a hospice nurse team director. Currently, I am a clinical instructor with Herzing University as I am getting my MSN, and I teach a plethora of both BSN and LPN clinical courses. My professional goal is to obtain my MSN in nursing education and share my expertise in an academic setting, inspiring and equipping future nurses with the knowledge and skills needed to excel in this field. I am passionate about fostering the next generation of healthcare professionals, and achieving this goal will allow me to make a lasting impact on nursing education. Now, in order to obtain the goal that I just explained, it's important to understand the role of the academic nurse educator. The primary responsibility of an educator is to facilitate learning and create an environment that supports it, rather than simply imparting knowledge on students. Although it is impossible to force someone to learn, creating teachable moments and actively involving students in the educational process are effective ways to educate others. The National League for Nursing established 8 core competencies for nurse educators to define how nursing faculty should be properly prepared to teach. These competencies include what is on the slide here. So they are to facilitate learner development and socialization, use assessment and evaluation strategies, participate in curriculum design and evaluation of program outcomes, function as a change agent and leader, pursue continuous quality improvement in the role of the nurse educator, engage in scholarship, and function within the educational environment. Collectively, the National League for Nursing core competencies listed on the slide are regarded as the benchmark for nurse educators and a manual for training nurses to work as academic nurse educators. The promotion of excellence in nursing education depends on the competency of nurse educators. Through their studies, nurse educators contribute significantly to meeting standards as they advance nursing. Teachers must be proficient in the application of technology and evidence-based educational practices, as well as clinically competent in nursing curriculum areas. Qualifications for this role also include leadership, knowing theories and principles of adult learning, advocacy for both patients and our students, monitoring and evaluation of students and the curriculum, ethical and legal principles, research and evidence, therapeutic communication, emotional intelligence to ensure that we can understand what our students are going through during their learning process. These are credentials that I've personally accumulated throughout my career thus far and will continue to develop in my emerging role as a nurse educator. The role of the nurse educator, the qualifications needed, and my personal professional goals all align with my philosophy of nursing education. As a nurse, I value the significance of imparting knowledge and fostering critical thinking skills in the next generation of healthcare professionals. This sense of purpose has been the driving force behind my decision to become a nurse educator. Just as I prioritize patient-centered care, student-centered education will be prioritized in my role as a nurse educator in the academic setting. With clear goal setting and open communication, I work to foster an environment where students can flourish. My teaching philosophy emphasizes active participation in every interaction and respect for the learner as an entire being. As nurses, we subconsciously cycle through the nursing process with every interaction we have. This also includes the assessment and planning of the trajectory of our own career development. I have created a 1-year, 3-year, and 5-year plan to which I am working towards to progress within this field. Nurse educators need to be ready to comprehend the requirements of learners, support their learning, acclimate students to the workforce, assess learning objectives, and reassure employers that their graduates can deliver safe, competent, and moral care. This being said, my 1-year plan is to begin working in the role as a nurse educator, still remaining at Herzing University. Within this year, I plan to implement the competencies related to the role of the academic nurse educator to grow my understanding and efficiency within the role. My 3-year plan is to become a certified nurse educator. The CNE test blueprint aligns with the core competencies established by the National League for Nursing, the same competencies that I will be focusing on during my 1-year plan. Obtaining the CNE accreditation validates one's knowledge, accomplishments, and personal accomplishment, while also supporting proficiency in an advanced practice role. Lastly, my 5-year plan is to either have or be in school for my doctorate of nursing practice in nursing education. Once I complete my DNP, my goal is to work as a full-time didactic nursing instructor. Self-improvement is essential for a nurse to continually enhance one's skills and knowledge, providing the best possible care to patients and staying up to date with advancements in the field, especially when your role is to educate others on these exact topics. Reflection can be a powerful tool for self-improvement in nursing. Through self-reflection, nurses can critically assess their experiences, actions, and decisions in the clinical and academic settings. There are 3 main types of reflection, including reflection for action, reflection in action, and reflection on action. Reflection for action is planning for the future by considering your goals and using past experiences to assist you in understanding how you will get there. A person can adjust or change what they are doing when they reflect on their behavior while carrying out a task. This is otherwise known as reflection in action. Now, developing a fresh viewpoint is the main goal of this kind of reflection. A review of the action process in retrospect, as well as examining the data gathered in terms of expertise, fresh insights, and career advancement, are all extremely important for my own self-improvement. Enhancing the quality of the work that nurses do encourages lifelong learning for all those who teach. Nursing education will continue to thrive if faculty members are encouraged to develop in all facets of their roles as educators. As a nurse educator, I can actively participate in continuous quality improvement by regularly reviewing and updating my teaching methods, curriculum, and assessments to ensure they all align with the latest best practices in research, ultimately fostering an environment of excellence in nursing education. Now, I would like to leave you with this simple yet meaningful quote given by Florence Nightingale. Let us never consider ourselves finished nurses. We must be learning all of our lives. Thank you.